Okay, in this video, I'll be applying a urine bag to an infant. So the first thing you want to do, you want to come in the room, you want to introduce yourself, you want to check the patient's and the infant's name and a date of birth. You want to wash your hands, you want to put on gloves, you want to explain the procedure, to the patient of what you're going to be doing to the infant, and you want to get the patient's permission. Once you obtain that, you want to check the doctor's orders. After you check the doctor's orders, you already have on your gloves. Okay. So then when you come to the infant, you want to take the diaper off of the infant. And when you take the diaper off the infant, you want to make sure you clean the infant good. Once you clean it, once you clean the infant, then you want to take your gloves off. You want to wash your hands, and then you want to re-glove. Okay, so now that you've re-gloved, you want to come with a cotton ball and mild soap. You want to clean the genital area of the infant about 3 times. You want to go from the penis to the scrotum for boys, and then you want to go from the you want to go from the clitoris to the anus for the girls. Okay, and like I said, you want to do that about 3 times. Once you've done that, and you've cleaned them well, you want to dry. Make sure they're dry well, and then you want to get your bag. You want to, I don't have a bag. Okay, you want to get your bag, and the bag has like a adhesive on it with the opening. So if it's for a little boy, you want to put the opening over the penis, and if it's for a little girl, you want to go lower and make sure that the adhesive is over, like around the labia for the girls. Okay. Once you put the adhesive on, you want to make sure that the adhesive is on there tightly, and is on there tightly, and the seal is good so you want to prevent any leakage occurring. So since it is going to take time, you want to put a diaper back on the infant to cover the bag. Okay, and then you're going to be checking the bag frequently to look for the urine. So when you come back to do your rounds and you check on the mother and stuff, you'll be checking on the infant as well to see if you have any urine. Okay, so we come back, we've checked, and we check the diaper, and we see that urine is in the bag. So you want to take the diaper off. You want to remove the adhesive by folding the bag over. Once you folded the bag over, then you want to put the bag into the specimen container, and then you want to tighten the specimen container tightly. And once you do that, you want to label the specimen. Make sure that you labeling it properly, with the infant's name, date of birth and everything like that. And then once you finish labeling, you want to send it to the lab promptly. You want to make sure you get that down to the lab immediately. Okay, and then before you transfer to the lab, before you leave the room, you want to take off your gloves, wash your hands again, get rid of all of your trash and everything, and make sure the patient and the infant is comfortable. If the patient have any questions, make sure the patient's call light and everything is in their in there, near them, and make sure they have all of their belongings and anything they need beside them. And that concludes the video of applying a urine bag for collection.